morning, everybody. I'm very pleased to be joined by the Minister for Health, our Chief Medical Officer, Dr. Chant, and Deputy Secretary of New South Wales Health, Susan Pearce, to give the community an insight into the Max Vaccination Hub. We are preparing for use, obviously, of the vaccine here in Homebush in Sydney Olympic Park. At its capacity, we're expecting this hub to be able to dispense around 50,000 vaccines, 30,000 vaccines every single week. So our capacity is 30,000 just from this centre alone. And given recent health advice regarding the Astrazeneca vaccine, there's no doubt there'll be a greater reliance on the Pfizer vaccine. And this hub will be able to safely, in separate zones, be able to administer either vaccine. We are looking at the footprint. As you know, New South Wales Health has already identified over 100 states, 100 sites around New South Wales, which people will have access to the vaccine. Some of those sites have now been converted or will be converted to being able to dispense the Pfizer vaccine, given the likelihood that that vaccine will become more prominent into the future. I want to thank everybody from New South Wales Health for making this possible, and Susan Pearce will give an update on the situation. We hope to have this up and running by the middle of May. But of course, it also depends on the doses that we have available to us. But I will say this, that New South Wales Health has been advised in the next few weeks of the doses that we're receiving, and in relation to both Pfizer and Astrazeneca, that New South Wales will be receiving. And it's important to note that this mass vaccination hub will be needed if we have to dispense with all the Pfizer vaccines that we've made available to us. So if the information we've been provided materialises, this vaccination hub will be necessary to get us to get the Pfizer vaccine out to everybody who is in those categories of individuals who need it. And that is certainly our objective, to make sure that whenever those doses become available, that we safely dispense that to the community. It's also important to note that everybody must continue to follow the health advice, and we're also working very closely with the GP network in New South Wales. Traditionally, New South Wales has an extremely strong GP network. Ordinarily, when it comes to regular vaccinations like the flu, the GPs mainly do it, but given there's 2 doses required in this and there's 2 different types of vaccine, that obviously means that the state governments also need to consider their role in dispensing the vaccine. But in the first instance, we want to work very closely with the GP network in New South Wales to make sure that they have access to all the AstraZeneca doses that they need. Obviously, because of refrigeration issues, the Pfizer vaccine is less able to be administered through the GP network, but we're also encouraging anybody who has underlying health issues, is in the relevant age categories, to go through your GP when you're getting the AstraZeneca vaccine. That's really, really important. If you have any existing health issues and it's your turn to get the vaccine, AstraZeneca, we really encourage you to go through the GP network, and there's capacity for increased doses to be given out by the GP network, and New South Wales Government strongly encourages that, because if we're thinking about trying to expedite the rollout of the vaccine in a safe way, we need to make sure the GP network is utilised, as well as anything that we can do from the New South Wales Government perspective to complement those services. I'll now ask Minister Hazzard to say a few words, then Susan Pearce, and then Dr. Chant will provide an update on various health issues regarding COVID. Thank you.
I just want to emphasise that our priority as the New South Wales Government, of course, was and currently remains to ensure that the frontline quarantine staff and our frontline health staff and then the broader health staff are all vaccinated. And we're well done in that regard. We've had pretty well all of our quarantine staff have been vaccinated. It's only new staff that come on board that have to be vaccinated. And of roughly 140,000 health staff, we have completed all but about 50 to 60,000 across New South Wales. So as we progress, we obviously will be looking to move into the other areas that the federal government has asked us to look at. But in the first instance, as the Premier has said, in the first instance, your GP is your port of call. So if you're not, or if you are a resident of New South Wales, you should be chatting to your GP in the first instance. If you don't have a GP, well, of course, there'll be some backup through the provisions of the services that will be available from the New South Wales Government, as we have offered and now working more with the federal government to broaden the group into the groups that the federal government were going to be doing. Can I also just say that This particular facility, I want to thank the health staff and all of the other staff who will be working in here, but particularly the health staff who are making sure this comes online as quickly as possible. It's a very big task to produce a new mass vaccination centre. This has not been done ever, to my knowledge, in New South Wales. So to have a mass vaccination centre like this, operational effectively in a spot where you can have a 6.5-minute walk to the local train station, 6.5-minute walk to the local parking area, is quite novel. And I would encourage the community to listen to what the government says over the next few months. And if you don't have a GP, you'll have very ready access to this service. Finally, I just want to say that there is obviously some issues in regard to the Astrazeneca that the government is looking closely at with the federal government. But we are, as a state government, dependent upon the federal government's advice in regard to the Astrazeneca. And it's important then that as we all listen to that advice, that individuals go to their GP and take the advice of their GP. Your GP is the person best placed to give you, if you have any issues at all, it's the person best placed to give you that advice. I will ask Dr. Chant to say a few words. Susan Pearce, and Susan and her team, along with Dr. Teresa Anderson, have been putting this together. So I'll ask Susan Pearce, as Deputy Secretary of Health, to have a chat about, or have a discussion about what's going on here.
This centre here at Sydney Olympic Park will be a wonderful addition to our existing clinic footprint across New South Wales. We already have a number of Pfizer sites, as you know. We are expanding those further from next week into other parts of the state, and this centre is an excellent complement to all of that. One of the other exciting things about this centre here at Sydney Olympic Park is that New South Wales Health is partnering with other organisations to bring this together. So our colleagues at HealthScope, our colleagues at Ramsay, Sydney University and Western Sydney University are all partners in this endeavour, along with a lot of other government organisations who will be supporting us through this, including Transport for New South Wales, customer service and other government organisations. So it's a truly collaborative effort. Can I thank in particular Dr. Teresa Anderson and Sydney Local Health District, who have been working so hard to put this together so that we are ready to open toward the middle of May, along with our colleagues at South Western Sydney and Western Sydney local health districts. We need this centre if we're to deliver the number of vaccines that we need to here to complement our GP network, and in particular that Pfizer vaccine. We've got great capability to do that and have been progressing very well with that, and I look forward to the day that we welcome our first customer to this building. Thank you.
Thank you. So New South Wales reported no new locally acquired cases of COVID in the 24 hours to 8 p.m. last night. There were 7 new cases were acquired overseas, bringing the total number of cases to 5,211. Pleasingly, there were around 10,264 tests were reported to 8 p.m. last night. We did announce last night that we were investigating a potential transmission event in our hotel, the Mercure Hotel on George Street, Sydney, CBD. I'd just like to take you through the thinking around that, because obviously we act in a precautionary public health way while we're better understanding how transmission occurred. So we have two different groups, an individual traveller and then a family group of 2 who were travelled on the same plane, in the same section of the plane. But we know that their day 2 tests were negative. So they both weren't infectious when they had been travelling on that plane. And then we also know that there were no flight crew on that plane that were positive. So therefore, in-flight transmission is less likely. There is sometimes a chance that you have a false negative test, but again, if someone's highly infectious, we tend to see those false negative tests in those with very much higher or borderline CT values. But as you know, health keeps a very open mind as we're pursuing these investigations. We cannot rule out a common source perhaps in the airport in Malaysia, but again, the fact that they would have transmitted to 2 independent people who then caught the plane, that's obviously a factor into consideration. But what we are concerned about is whether there could have been transmission, given that these two cases were adjacent to each other in the hotel. So because of the implications if that transmission event occurred in the hotel, the question is could other people have been exposed? We take a precautionary approach, and hence the reason for our public health actions, even though we don't have a definitive conclusion around the way the transmission occurred at this point in time. There were about 40 people staying on that floor during the period that we're concerned about where the infectious people were on that floor before they moved to our Sydney Health Hotel, which is where we move all positive people. We have managed to contact 36 of those individuals. A number have gone into other states and territories, and those states and territories have been alerted, and we've shared that information. And we are urgently escalating contact with the remaining 4. So we were happy to update you on the investigation. Obviously, there's also an environmental investigation occurring at the hotel. Again, at this time, nothing obvious has come from that, but our investigations are ongoing. Happy to leave it there and take any questions.
This is the second time in, what, about a week that there's been a potential or a proven case of transmission within the hotel quarantine system. Does anything need to change in that system, considering there's an increased risk of people coming back with COVID, and we're seeing more people coming back with COVID? How's the investigation into previous hotel quarantine transmission?
So I think you're raising some very valid points, that we're seeing that in many countries in the world they're going through increased levels of COVID transmission, so often going into their next waves of transmission. And we are seeing quite high positivities come in relation to our returning travellers, despite the fact that we've instituted testing within 72 hours of their departure. We have put in a range of measures at the borders to protect us from incursions, and it's been pleasing to see that whilst we have detected these, what we call incursion events, they really haven't then led to further transmission. So some of the measures we've put in place, it's the daily surveillance testing of our staff through the salivary testing of staff in our quarantine program, and we've also implemented vaccination of both the quarantine staff and the families of quarantine workers, again to give us that rings of protection. The variants of concerns, a number of the variants of concerns are associated with higher transmissibility, and we do know that airborne transmission can occur. The investigations have looked at how transmission occurred, and in the previous one there does seem to be some evidence that perhaps some air transmission that under particular circumstances could have occurred through the corridor and into that adjacent room could have explained that, and further actions taken. So every time across Australia, New Zealand, across the world, these transmission events happen, we look at how the transmission happened and whether there's any additional safeguards that we can put in place. But we cannot be complacent. We know that there is inherent risk in our quarantine system, but it has kept us safe. We have had many, many returnees through this system, and New South Wales is taking the bulk and continues to take a bulk of returned overseas travellers.
How did that air transmission potentially occur? Was it through a ventilation system, through someone opening
No,
the door at the same time?
it is that under certain circumstances, if there are additional gaps in doors that are not recognised, there can be, under unique circumstances, airflows. We're further understanding this, but clearly there's been a lot of initiatives taken, such as making sure that all door seals are tight, that we're obviously doing things around minimising door openings and closings, and we're obviously positioning any security staff or staff to minimise any exposures to site. So there's a range of measures are put in to minimise the risk, but we cannot totally remove all risk. What we need to be committed to is to look at these events as closely as possible, continue to learn and continue to improve the quality of our quarantine program.
Will New South Wales consider using only every second room in quarantine hotels? Has that been floated?
Certainly, all of those measures are open for consideration, particularly where we may have multiple family members. So what we do know is that some of the transmissions events have occurred when we've had multiple people in our room that have come down with the illness. You can imagine that if you've got more people in an area, then the viral load in that environment can be much higher. So clearly some of those considerations, particularly where you've got multiple people quarantining in a family-like setting, that may be totally appropriate where we do look at that additional spacing as a control. So no measure is discarded. We're looking through all measures and we look closely at all of these incidents, including those that are occurring in other states and territories and across other jurisdictions internationally.
Premier, you mentioned that the federal government had given a number of doses. Can you reveal that number?
Yeah, look, we're always anticipate, we get some advance notice of what is anticipated that arrives. It's not always that precise figure given supply issues, but we anticipate that in the next few weeks we'll be getting sufficient supply of Pfizer to be able to vaccinate those categories that we have responsibility for. And we're looking forward to getting on with the job of doing that. And that's why it's important for us to look at the footprint we have already across the 100 sites in New South Wales, to look at opportunities where we can dispense Pfizer more readily. And we also have to be ready to scale up and down depending on those supply issues. And that's really, really important.
Melbourne has managed to open their mass vaccination centre already. Do we need this one open now?
No, I think we've planned to have it open in mid-May, and that's when we'll need it. That's when we know that we're likely to get some additional doses of Pfizer beyond what we're receiving now, and we're looking forward to doing that. We're looking forward to making sure that we complete our job in terms of the key workers, quarantine workers that are new and their families, which is important as well. New South Wales has always taken the approach to make sure we have a safe vaccination program for all those high-risk occupations, high-risk individuals, to make sure it's safer for them but also safer for the community and reducing the chance of community transmission, and that's always been our priority, and that's why we took a strong stance in making sure that that happened. And we're also having conversations about aged care workers. That was going to be something the federal government had responsibility for, but given the risk involved in aged care facilities, we're keen to support the federal government in expediting vaccinating those workers, and we'll be having those conversations.
Someone that we open to
aged care workers, Premier, has the federal government asked
Oh, look,
about
those discussions have been ongoing. As far as New South Wales is concerned, our job is to keep the public safe, is to keep the community safe. And if that means expediting categories of workers that haven't been done to date, well, we're happy to do that.
And do we need the extra Pfizer that is being promised by the federal government to meet the target of 300,000 doses within 12 weeks? Do we need that more Pfizer?
Yeah, there's nothing to suggest we won't receive the Pfizer that's been committed to us already, which is why this centre is necessary, because it means that we can undertake 30,000 doses every week. And we're hoping once we get our rhythm, there could be a chance that we do slightly more than that. But at a basic number, we're hoping to get 5,000 doses dispensed in this centre alone. And at some stage, we'll be able to do both Astrazeneca and Pfizer here, but this will be the only place where you can do both vaccines.
By mid-May, do you think that you'll be able to simply walk in off the street? I mean,
no, we're not recommending that at all. We're recommending everybody book. We don't want anyone. It is our strong preference not to have people walking off the street, especially if you're getting the Astrazeneca vaccine. We want people to book ahead to make sure.
But for all ages, then, that's what I'm saying. So anyone who wants the vaccine, makes a booking, will be able to come in.
Well, yes. So, it depends on the categories. Obviously, the Pfizer vaccine is only offered to certain categories of individuals. So, if you're eligible for that, obviously you book ahead. And with AstraZeneca, the first port of call is your GP. But if you don't have a GP, or you want to come through a New South Wales government facility, well, then you have to book ahead as well.
When it opens, Premier, do you expect that you'll be doing more Pfizer or more AstraZeneca? What's the expected use?
Yeah, the expectation here is it'll be predominantly Pfizer in the first few weeks, because obviously we still have categories of key workers and their families that we want to see vaccinated. So our expectation is that predominantly, initially, it'll be mainly the Pfizer vaccine until we get advice on other age categories. At this stage, the advice for the public to come forward for AstraZeneca is over 70, and until there's further health advice from the federal government, we'll make sure that we follow that advice.
And you'll have the choice, Premier? You can, as a customer, come in and say...
No, unfortunately, there isn't a choice. It depends on, it depends on your age, but also the category of work you are, and obviously that program's been put in place. In the main, the New South Wales government will be dispensing the Pfizer vaccine. We're encouraging the GP network to mainly dispense the AstraZeneca vaccine, obviously because they don't have capacity for the refrigeration which the Pfizer vaccine requires, but also for health reasons. If anybody has any concerns about the AstraZeneca vaccine, or they've got underlying health issues, they should in the first instance go through their GP, especially older people who might have underlying health issues. We recommend strongly they go through their GP. But if you don't have a GP or you want to have access to the vaccine, obviously then you can come through our system.
Premier, really broadly...
So I'll come back in a second, yeah.
Really broadly, do you think it'll get to the point in the next 6 months where everyday people, say people like in this room who may not have health issues, can go to a pharmacy and easily, like we do with a flu shot, book online and just get it done really quickly?
Well, look, that's a matter for the federal government to determine.
Would you like to see it?
Well, I think what's important at this stage is to make sure that everybody has access to good medical advice if they need it, and make sure they have all the booking systems in place. What I'm keen to see is our GP network in New South Wales utilised. I know a number of GPs want to be involved in the system and want more doses, and that's the best port of call for people receiving the AstraZeneca. But as I said, if you don't have a GP or you're comfortable coming through the New South Wales health system, please do so. And with Pfizer, obviously, the New South Wales government already has our systems in place, and Pfizer at this stage is offered to certain categories of health workers. I'm not one of them, which is why I took the AstraZeneca vaccine, and that's the way we're moving forward.
The Victorian government...
Oh, sorry, you were next, yeah.
Can we expect a date confirmed date when that will happen?
Well, look, that's a matter for the health advice and the National Cabinet, and I've always argued we should be very less rigid on the way we roll out the vaccine, and I stand by that, but we've also got to make sure we follow the health advice and make sure that people do have access to good advice especially if they have underlying health issues or have concerns. And as I said, we have capacity here to do more if we get those doses, but we also have to be aware that for New South Wales, our priority is really vaccinating those key workers and their families to reduce the chance of community transmission. We've already seen that through our quarantine system. We've been, without being too immodest, our quarantine system has really stood the test of time, and the challenges on it every day. 3,000 Aussies coming home every week through Sydney Airport. More than 5,000 Aussies in hotel quarantine in Sydney at any given time is a huge job, and obviously with that come thousands and thousands of workers and their families, and we want to make sure they're all vaccinated and taken care of in the first instance. I'm sorry, you were next, and then yep.
The Victorian government has given money to help fund local production of the vaccine. Is that something New South Wales is considering?
Oh, look, we're very keen to be part of a process like that. In fact, we have some of the nation's leading experts in that manufacturing technology here in New South Wales, and the Health Minister has already undertaken to write to his counterpart to offer our services and to be part of that collaborative approach. We would like to be part of a national approach which sees the local manufacture of the vaccine, and if New South Wales can be involved in that, I'd be very happy with that.
That's the mRNA vaccine.
I'm sorry?
That's the,
yeah, exactly, yeah.
Are you going to put any money in?
Well, we've already put in excess of $4 billion into dealing with health issues around the pandemic, so that wouldn't be a challenge.
And Premier, the WA Premier has expressed some grave concerns about the incoming Indian passengers. Anyone from India wants to basically shut down that market. Do you share those concerns?
Look, we have always been very open with the fact that when there's high rates of infection from any country, that is expressed in the hotel quarantine system, and that was the case with the UK and the US. I don't think it's fair or appropriate to distinguish one nation ahead of others, but what I will say is what this does highlight is the job that New South Wales has been doing in having the lion's share of the burden across the nation. We've had to deal with these issues for a long time now, and when you've seen the infection rates go up in a particular country, that is reflected in the infection rates coming through our quarantine system. As Dr. Chant said, we had 7 additional cases overnight. That means potentially 7 lots of workers dealing with COVID patients in addition to the ones we already have. So that's always a risk, but I don't think it's healthy to identify one nation ahead of others because that can change. The rates of infection go up and down across Europe, across North America, and we just have to make sure our quarantine system is as foolproof as possible because Aussies who want to come home should have the right to do that.
Premier, considering that there's going to be potentially a yearly jab, how long are you anticipating to have this centre open for, do you think, looking
Oh, well, it'll be indefinite because we anticipate having this centre remain indefinite depending on the number of doses we have. There might be times at which we scale up or scale down, and that's why, as Susan Pearce from New South Wales Health explained, we have this centre in partnership with a number of other providers to make sure we have the capacity to scale up and down, because every time you open a centre like this, it requires health staff, and those health staff come from area health districts, which means they might be taken away from their ordinary jobs. And so it's important for us to complement those jobs to make sure that we don't take anything away from the health requirements of our population more generally, because we do want people who need the medical attention to come forward and do that. We're only having a conversation yesterday to make sure that those who do rely on allied health services still get that. People should come forward. I know during some parts of COVID, people were more reluctant to come forward if they had other underlying health issues. We encourage everybody who needs medical attention to come forward and get it, and that's why it's important for us to have those partnerships so that our staff aren't burdened by having just to do this on their own.
Pfizer is clearly high on your wish list. Will that be your focus now? Is because there's so many questions, and we talk about the hesitancy of taking up Astrazeneca. Pfizer is your focus now to get as much Pfizer you can into the New South Wales?
Well, it's important to note that all vaccines have a level of risk associated with them, depending on the category and where you are. But clearly, we're very keen to dispense as many doses of Pfizer as we can, especially because New South Wales health authorities have the refrigeration capacity. We have the capacity to scale up. GPs don't have that capacity, which is why they're dispensing the Astrazeneca. But also, if there are issues with Astrazeneca and you are of a certain age group or have underlying health issues, you should go through your GP. So I'll do Clinton and then come to you.
I know with AstraZeneca, we hear it from calls to our station, there's still a lot of apprehension. You've had it. Is there a message you'd like to get out to people who are in 2 minds about it?
Well, I think if you are in 2 minds about it, you should speak to your GP or get medical advice. Explain your situation, your age group, and just be aware of the risks. And everybody has a different risk profile. Some people are more cautious and will want to wait. Other people will say, well, the risk is low and I'm happy to take it. And it's really individuals making those assessments for themselves, but also in consultation with your GP. If you do have underlying health issues or concerns, you should be asking those questions of your GP. And if you don't have those issues and are keen to get the vaccine, you should still read the consent form carefully to make sure you understand the risk before you take it. And everybody has a different approach, but my strongest advice is always follow the health advice. Follow the advice of your GP, follow the health advice, and then obviously move forward.
Premier, just on the numbers, Premier,
Yeah.
the Pfizer doses you're getting from the Commonwealth, what have you been getting each week over the past couple of weeks, and what's that going to change to? Is it a big difference?
Yeah, so if you look, New South Wales, and this is an important factor I forgot to mention beforehand, New South Wales Health, we've been providing daily updates on how many people have received what dose and if it's their first dose or second dose. And what we're intending to do moving forward is also include the GP network in those numbers, because we think it's important for our community to know how many people have received the vaccine in New South Wales and what the vaccine has been. So you'll see that reported daily. In relation to Pfizer, we are expecting increased doses in the next 3 or 4 weeks, but I'd feel more comfortable talking about those numbers once we receive them. But please know that every day there'll be an update of how many doses we're dispensing in New South Wales.
The Minister mentioned there's about 50,000 healthcare workers still to receive their dose. If you're doing 30,000 a week through this centre, I mean, you'll get through those pretty quickly. You've then got the rest of the emergency personnel to...
Well, yeah, well, remember...
How long do you
Yeah, well, remember, people need 2 doses, it's not just one, so there's still outstanding tens of thousands that need to get their first dose, then their second dose, and then we're also keen to do the families of key health workers as well with the Pfizer, because obviously they're at high risk, because once you provide the vaccine, especially to those under 50 who can take the Pfizer in those high risk categories, you reduce the risk of community transmission. That's always been our aim in New South Wales. It's always been about how can we reduce the risk. We also know that there's a huge risk around aged care workers, and whilst initially that wasn't something we were asked to do, we're keen to get the vaccine out to aged care workers to make sure they don't unintentionally bring it into their workplace and then affect the most vulnerable. So we're having those conversations with the federal government. I'm pretty optimistic that they will agree to our strategy, given the most recent advice with Astrazeneca, because the Astrazeneca advice, especially around under 50s, has caused us to recalibrate our strategy. It caused us to see what we can get done as quickly as possible. And obviously, the more doses of Pfizer we have, the more ability we have to prevent community transmission in New South Wales. But we're also keen to see those who can take the Astrazeneca to do so as well.
Minister, just quickly...
Minister Hazard, in relation to the daily jabs, I mean, the numbers have gone down in the past week or two, and you've still got frontline health workers to get through. What's that take up like? Are people still turning up to their appointments, and are you still getting through those health workers, especially maybe the younger health workers? Are they still coming forward for an AstraZeneca jab?
It has proved rather challenging in the last couple of weeks. When we commenced our rollout here in New South Wales, the enthusiasm was extremely high from health staff across the state and quarantine staff. But I think it's fair to say that the federal government expert committee advice that was given to the Prime Minister and to the Federal Health Minister, Minister Hunt, then saw, of course, the announcement at 7:15 p.m. 2 weeks ago by the Prime Minister and by Minister Hunt, expressing some concerns about the use of AstraZeneca in particular age groups. Obviously, it's a complex issue. The Premier was just talking about the risk factors that each individual has to consider, and that's certainly the case, but of course it's got to be looked at in the context as well of what the broader risk is to the community. So each individual's risk is relevant to not only their own medical circumstances, but also what's happening in our broader community. And in our broader community, because of the very positive management across Australia, and particularly here in New South Wales, the risk at the moment is pretty well non-existent of actually getting the virus at the current time. So what we have seen is a fairly dramatic drop-off in the number of people who are in the health system coming forward for the AstraZeneca jab. In fact, we've seen approximately 70 to 80% of people, of less people, showing up for their appointments, so they're cancelling or they're not coming. Is that going to continue? Well, I think this is a question we can ponder, because obviously the announcement by the PM and by Minister Hunt 2 weeks ago, off the back of that expert federal committee, has caused a level of concern in the community. That's the plain facts. Whether it will continue, we don't know the answer to that yet. What I would say is that at some point, we're all going to have to learn to live with this virus. And at some point, our international borders are going to open. Now, those are matters for the federal government largely to determine. But if our borders were to open, we will certainly have to learn to live with the virus. And therefore, I think each of us as individuals are going to have to weigh up our own risk in the context of the broader risk of COVID. And let me finish, please. Let me finish. And I think the issue here is that, certainly from my point of view, I've had the first jab of AZ, and at my age, and with my medical conditions, I will be looking forward very much to having the second AZ jab as soon as I can have it, AstraZeneca jab as soon as I can have it. But that's because I also recognise that at some point the borders will open. I think at the moment we're living in a bit of a bubble here in Australia. The rest of the world is seeing the highest rate of infection that we have seen since this pandemic started. When we open our borders, the reality will hit us. When those borders are open, though, are left as a question that's open at the present time for the federal government to determine. And I think we all have to weigh those risks up as we proceed. But certainly, health staff have voted with their feet at the present time and seen a 70 to 80% reduction. I'm hoping that will turn around over the next few weeks as more information becomes available.
Last few questions, please.
The federal government's announcement about TGA advice had caused concern. Is it the announcement?
It was actually the Atagi's advice.
Sorry. You said the federal government's announcement of the Atagi advice is what had caused concern. Are you suggesting that the way the federal government announced the Atagi advice has contributed to a 70 to 80% drop in people turning up?
Oh, look, I'm not going to reflect on that. I'm simply saying that at the present time there are concerns that have developed in the community and in the broader community. It's not reserved to health staff. The GP networks have been confirming that they've had a lot more challenges in being able to dispense the medication, the vaccines. It's an interesting state-by-state position too, because I know all the advice I'm getting from Victoria is that Victorians seem to be still very keen to get the vaccine, or a lot keener than perhaps we are in New South Wales at the present time. But if you think about it, we've managed, here in this state, we have managed our state, I think modestly I would say this, that our health officials have managed it extremely well. And as a result, people have not been exposed in the same way as they were in Victoria. There's a rawness, if you like, of scar tissue in Victoria off the terrible circumstances that they did face, which obviously we were all very concerned about. And so people in Victoria are keener to have the vaccine currently because they know that once the borders open, there are some real issues. Here in New South Wales, perhaps we've been a little bit insulated from that, and only time will tell. Every day. The one thing I've learned as Health Minister in this 1 in 100 year pandemic is never say never as to what might happen tomorrow or even later today. I'm hopeful that the community will listen to all of the wise medical and scientific advice, weigh it up, and at some stage move towards having the various vaccinations that are available for them as soon as possible. But that's because I also recognise that we will have to open our borders at some point.
Last question, please.
Have any plans to engage pharmacies soon? They say that mass vaccination hubs are useful to people in the regions and they're the logical next step for equal access across the state.
Look, we're not ruling that out, but obviously the national government are working with the pharmacists and their two representative bodies to determine when and where that would be appropriate. But at the present time, what I would say is that our GPs are reporting that they have concerns about getting enough vaccine to do their job. So I think the focus from the federal government is probably going to be, and our government will be, to make sure that we encourage as much as we can the vaccines to be made available to the GPs who are already set up to do the job.
Can we ask one other question about another issue, just briefly?
Thank you.
I know you. Sorry, Minister.
I've been shoved aside many a time.
I know you can't comment directly about the corruption allegations, but were you concerned when Mr Sidoti said on Tuesday that he'd been signing off on documents since '92 for years and years without reading them properly?
Oh, look, I don't want to comment on that active investigation. I'll leave that to the experts.
It's essentially admitted that breaching ministerial guidelines by not declaring the income of his wife whilst he was a member and in fact later on a minister in your government. Surely that would concern you.
Oh, look, these are matters for the Integrity Agency. I have full confidence in the process, and like everybody else, I wait the outcome of their investigation.
Thank you.
Premier, what's your priority for National Cabinet tomorrow?
If you ask me a question, I should at least be able to finish a sentence. Sorry, what was the question?
Premier, what's your priority for National Cabinet tomorrow?
Look, the priority is, what day is today? It's Thursday's today, yeah. I just have to make sure what day of the week it was. No, it's today. Look, the priority is just to have clarity moving forward and also to put our case about being able to use the Pfizer vaccine to make sure we're able to vaccinate the families of those key workers that we think are high risk, as well as support for vaccinating aged care workers. That's certainly my priority. We have those doses of Pfizer available to us in the next few weeks, and we need to make sure those most high risk have access to it.
Are we running low on Pfizer? That's why you're very
I'm
keen
sorry?
about. Are we running low on Pfizer at the moment?
No, the information we have is we're likely to get more doses than what we've been receiving to date in the next few weeks, and that's why this mass vaccination vaccination hub will be necessary for us to make sure we get that out.
Thank you.
Thanks, everybody.
Thank you.